I'm Dr. Polack. I'm one of the pediatricians at Progressive Pediatrics in Union City and Bayonne, New Jersey. And today my guest is Erica.
Hello, everybody. My name is Erica Bermudez. I'm an occupational therapist in Bayonne, New Jersey, and I specialize in pelvic floor therapy. And so, not many people realize that pelvic floor therapy can also be for pediatrics and not just pregnancy and postpartum.
Yep, it's kind of new, to be honest, for me to learn about it too. So I'm happy that we're having this conversation. So tell me,
Me
Erica,
too.
what age groups do you see in pediatrics and for what kind of problems?
Yeah, so I see typically the average is around 6 and 7 years old, and typically within that population, it's more bedwetting, accidents at school, accidents at home, constipation, and or fear of the bathroom.
I love the constipation topic. Let's dig into that a little bit
Yeah.
because I have so many patients of all age groups that come to me really suffering with constipation. And usually all I do is talk to them about diet. Sometimes there's laxatives involved. Sometimes I send them to the gastroenterologist. But this is a great idea to send them to a pelvic floor physical therapist. Tell me, what would you do with one of my patients?
Yeah, so typically it'll start with the first session, and I talk to the parents and to the child about what might be going on. And so I dig into the child's habits and routines and how the accidents happen, why they're happening, when they're happening. And I also talk about behaviors, so around potty. So, how often are they going to the bathroom? Are they sitting on the toilet for hours on end? I see if there's a sensory component, a behavioral component, or also more of a physical component. So, are they, how is their posture? Are they really, really tight in their back? Are they really co weak in their core? And so I take all of that information and develop a treatment plan for them. And then from there, I can give some education and advice to parents and do parent coaching virtually or in person, or I do therapy, including manual techniques and play-based therapy in the office.
So, real quick, tell me what's the right posture for a 5 or 6 year old if they are in the bathroom?
So in the bathroom, I would always recommend having a squatty potty or any type of stool underneath their feet. You want their knees above their hips slightly, and making sure that they're not hunched over, making sure that they're breathing throughout, that you can tell them to imagine that they're blowing out bubbles or blowing out birthday candles to help push as well.
Awesome, awesome. What other pointers do you have that you can give to parents to help avoid constipation or treat it if it's mild?
Yeah, I would say that my biggest recommendation for sure is making sure that your kids are not sitting on the toilet for 4 or 5 hours a day, making sure that they're sitting there for 10 to 15 minutes max. And if they need to go back multiple times, that's fine, but we don't want them in the toilet for hours. I would also recommend making the bathroom like cozy and not a scary place to be. So even if you can put one of those mats on the toilet seat so that it's more comfortable and not just like having their butts right on the toilet, having a picture in there so that they can feel calm. And then also making sure that you're speaking with your pediatrician, Dr. Polack, and any of the other providers at Progressive Pediatrics about nutrition, making sure that your kid is having enough fiber, and making sure that your kid is drinking enough water every day. A lot of my pediatric patients are really just don't want to drink water, and I often recommend making sure that the parents are on top of it by even giving them a fun water bottle with stickers on it and having water bottle time to make sure that they get in that water intake that they need.
I love that message, Erica, because a lot of my patients will come in and say, "Oh, my kid drinks water all day." But if your kid drinks water all day and they're not eating enough fiber, then that water just goes into the urine, into the urinary bladder, and they pee it out. So they need both fiber and water in order to have good, healthy stools. And, adults need around 25 to 30 grams of fiber a day, and kids need close to that, around 15 to 20. So we want to make sure they get enough fiber, and it's amazing how many people don't get enough fiber. So in
Right.
one apple with the peel, it's only 3 grams of fiber, but there's a lot of other fruits and vegetables with much more fiber. So it's easy to look up and try to get your kid the right amount of fiber and then match it with water. And that's how you can have healthy stools. So
Right.
this is a great point. Thank you for telling me that.
Yeah, of course.
Erica, can we end real quick by you telling me what kind of exercises would you recommend, let's say, to a 2-year-old or a 4-year-old in order to strengthen their core and help them to avoid constipation?
So I there's a lot of toddler and baby yoga programs. So you can even look it up on Google, like yoga for infants or toddlers. And it's just different positioning to help everything stay open and relaxed. I also recommend core strengthening. So you can do little activities, making sure that the posture is correct, so not slouched over, making sure that when they're playing video games, they're not slouched over either, but that's a totally different story. But yeah, so core strengthening exercise, they can lay on top of a physio ball and play puzzles like that. You could do bear crawls, crab walks, and I even like Twister because it kind of adds in a core strengthening and a flexibility component. There's so many play-based games that you can do for core strength and flexibility to help the pelvic floor.
I love bear crawls. I love those. Not that I love to
Yeah.
do them. I dislike them because they're hard.
Yes, they
But
are.
they're a great exercise for adults and for kids, and it really helps with the core strength. You mentioned earlier that you had a question for me. Tell me, what was your question?
My question was, at what age do you typically know it's time to start potty training?
Oh, yeah. So a lot of kids are ready to be potty trained between the age of 2 and 3. It's not exact, it's not an exact science at all. And it can take around a month to really toilet train a child. But most parents know their child is ready to be toilet trained when the child has recognition that they need to use the bathroom. So whenever you have that feeling like your child, you look in their eyes and you know that they're going to hide behind the couch to do their business, that's the right time to start to toilet train them. Try to get a potty for them that looks friendly and put it in a place that is nice and friendly so that if your bathroom is dark and cold, perhaps they might be scared of that. So try to avoid dark and cold places. That would just be my recommendation. There's lots of videos out there actually that kids can watch about potty training, like cartoon videos, not real videos, cartoon videos that are really helpful.
Oh, that's really, really great information. It's interesting. You mentioned you can kind of tell by body language when it's time to start potty training. And for
Yep.
me, as a pelvic floor therapist, I can know when it's time. It might be an indicator that you should send your kid to pelvic floor therapy if they're starting to have accidents a lot. And that's at around 6, 7, 8 years old. They'll start to do the potty dance, as we call it, especially in potty training as well. But if you notice that your kid is already potty trained, but years later they're still doing the potty dance and avoiding the bathroom, that's also an indicator that you could send your kid to pelvic floor therapy.
That's a really good point. And parents should be aware that after the age of 4 years old or so, if your child is still having accidents in school, like urinating on themselves in school or defecating actually, that is something to come and see your pediatrician about because it could be a urinary tract infection or it could be constipation or it could be other things. And then if everything is ruled out, then probably physical therapy will be helpful.
Occupational therapy too. But
And
yes,
occupational therapy. You're right. You're right.
yes. But yes, totally agreed. I think a lot of parents will assume that if a child is having accidents, there might be something wrong with their bladder, or their bladder control. But oftentimes it also could just be constipation playing a role and could also be some behavioral things going on. And so there's so many different things that we can look into. So yeah, definitely speak with your pediatrician about your options.
Perfect.
Yeah.
So that was really great and helpful. And thank you for educating us about how to avoid and treat constipation in kids. I appreciate your time.
Of course. Thank you so much for taking your time.
So once again, you can find us at Progressive Pediatrics in Union City and Bayonne, New Jersey. We are at progressivepediatrics.com. How about you, Erica? Where can people find you?
So you can find me on Instagram or TikTok at the pelvic floor underscore OT. And my email is thepelvicfloorot@gmail.com. And located in and I'm located in Bayonne, New Jersey.
Awesome. What is the practice where you actually physically located if someone wanted to look you up?
So you can look me up pelvic floor OT Bayonne on Google and I'll show up, but I'm also located inside of a physical therapy office, which is called Berg Physical Therapy.
Perfect. That's really helpful. Thank you so much and have a great day, everybody. Bye bye.